So what we're going to do today, our clinical leaders here will take you through a short presentation, purely practical skills, and then we will open the floor up for Q&A, answer any questions you may have about this topic or really anything related to your students' mental health and what you can do as educators and leaders to support that. Really, our main interest in doing this is to educate and add value to you, but also to learn from you about the difficulties that your students are having. That way we can go back to the drawing board and develop solutions to help. So we'll do maybe one more minute and then we can get started. Well, how about this? How about we start from, let's get started with introductions to our clinical leadership team. Dr. Henson, you want to start?
Yes, thank you, Shai. Hi, everyone. My name is Dr. Lindsay Henderson. I am a clinical psychologist with background in working with children and adolescents, and then also background in delivering mental health care using video-based technology across the country pre-pandemic. So really doing this prior to the time when everyone else was. So very pleased to be the clinical director for Fort Health and sort of marry my two areas of expertise and passion. So that's me. Dr. Beal.
Afternoon, folks. My name is Matt Beal, and I'm a child and adolescent psychiatrist based in Washington, D.C., where I'm the chief of child psychiatry at Georgetown University Medical Center. And I am also the chief medical officer for Fort Health, which is a new clinical entity providing services in New Jersey that we'll be talking with you about throughout the conversation this afternoon. Really glad you all are with us. And I'll turn back to Lindsay to walk us through an introduction. If I could ask also, while Lindsay's doing the introduction, if folks would be willing to share in the chat just a little bit about where you work and in what context and what age kids you work with, and that'll help us to sort of refine our remarks as we go along.
Yeah, we really want this to be conversational because you all are actually the experts here. We are not teachers. We are not in the classrooms. And so we don't want to give you anything you don't already know. But I feel very passionately about how the last several years in particular has impacted all of us across all settings. And so I think that you have been facing a new challenge. You're well aware of that, but sort of some good habits that we can practices and ways of life that we can strive to model for our kids and others, as examples of how to best kind of move forward in this world we're living in. But before we get into that, Fort Health, as Dr. Beal alluded to, we are a new pediatric telemental health companies now serving children and adolescents in New Jersey. And our goal here is really to partner with community pediatricians and other important members of the child's life, like school teachers and other educational supports. So we are clinicians, we are therapists, psychiatrists, and we are trained, experienced to deliver evidence-based care for kids and adolescents. For those of you who may be familiar with the Child Mind Institute, it's one of the nation's leading nonprofits for pediatric mental health, and our partnership with them really allows us to focus on good clinical care and put our money where their mouth is as far when we say evidence-based. This is a little bit about CMI, their dedication to research, to care, and to public education. And they have all sorts of programs and research. And by partnering with Fort, they are able to meet, to help fulfill their value, their goal to meet and reach more families outside of New York City and San Francisco. So proud to be built in partnership with them. But here today, we wanted to talk to you a little bit about what has always existed, a phenomenon in for children and behavior. But as we'll get to, is certainly developed and kind of gotten more complex and grown over the past 2 or 3 years. I don't know, Matt, if you want to kind of talk about like this, that you don't have to read off these stats, but what are the ADHD kind of facts and stats and figures that our school audiences should know about, should kind of be armed with?
So I think that you all are expert in this, as Lindsay said, and so what we're describing is probably your daily reality. But ADHD is, one of the most common mental health conditions affecting kids, and approximately 1 in 10 to 1 in 20 kids in every school setting, everywhere across the world, has ADHD. And how much kids are affected by ADHD can vary. It depends upon their age, depends upon the demands placed upon them in the classroom. It depends upon the skills and flexibility of the classroom teachers and staff that are working with kids. Also, I think it's really important to, this is a really sort of meaningful feature of ADHD to me as a clinician, is that ADHD is not a binary phenomenon. It's not like you have it or you don't. It's not like having black hair. Either you have black hair or you don't have black hair. ADHD exists along a continuum from mild to moderate to more severe symptoms, and how much they affect a kid's development and a kid's learning in the classroom and behavior in the school setting it can be very variable, and can be influenced by things like what are the demands in the classroom, as well as what's going on in kids' lives outside of school. So things like trauma and adversity in children's lives, things like their access to healthy food, their access to quality and sufficient sleep, stress and cooperativeness or lack of cooperativeness in the home. All of these features can make ADHD symptoms more or less prominent, and can make the diagnosis sometimes somewhat complicated. Lindsay's featured here just some of the features of ADHD in the classroom. I think this is probably familiar to everyone, but cardinal features include inattention, so things like careless mistakes and not able to finish work, easily distractible, or oftentimes doesn't seem to be listening, seeming to be daydreaming or zoning out or spacing out, difficulty keeping track of assignments and tasks and possessions. We all know kids who are on their third backpack by the third month of school, because they just can't keep track of things. And so that's can be a core feature as well. And then really trying to avoid any tasks that require sustained attention because it's so taxing for them.
Thank you. But we know that it's, as Matt said, it's not just ADHD, and I think it's not just that's not the catch-all for behavior that may look like ADHD both before the pandemic and then certainly after. So you all as school professionals, you are seeing day to day, every day, how this is presenting, how the stress of the past several years is impacting families and therefore children. So these stats are taken from a monthly survey of school leaders and administrators. And this is May 2022, and you can see these, that 87% of public school leaders reported that the pandemic has negatively impacted their students' social and emotional development, which is concerning for us mental health professionals. That isolation, that sort of stunting of the normal, developmental tasks of adolescence and childhood, it's been, impacted, delayed, stunted by the pandemic. Gaps of learning, 72% of respondents report an increase in chronic absenteeism in students, up from 39% prior to, in the previous years or prior to the pandemic. And then also the equally high stat for absenteeism and for teachers. So this, without being there, you're going to have gaps in the learning process that I think I would love to hear how you're seeing that play out or not, because we also know that kids are awfully resilient. So we don't want to lose sight of that. And then disruptive behavior. This seems to be the thing that is really like, when we dig into this, it gets a lot of headlines and people are talking about it. You guys are living it, struggling with it, and many people are leaving the field because of how difficult it can be to manage the realities of behavior in the classroom. So, over 50% say have observed increase in disruption of behavior in the classroom from misconduct and acts of disrespect towards staff and teachers. And I don't know how interactive this. I'm a little bit afraid I'm gonna lose my I guess I want to make sure that people feel like they can chime in here, or Matt, if I'm missing any comments here.
I'll keep track of it, Lindsay. And I think we had a little bit of a chat issue that's now fixed.
Okay.
So,
All right, cool.
Chat is now functional. Please jump in with comments, questions, and again, just sharing some background about your work will really help us to target our remarks best.
Yeah.
And by the way, if it's easier, how about we just allow everyone to talk, and then we can just make it into more of a conversation as well.
Sure.
I think we're small enough to do that.
Yeah, sounds good.
So now chat is working, and everyone can chime in vocally as well.
So what are the things that we've had our eyes on as mental health professionals, and since the start of the pandemic, what are the things that kids carry with them that don't have anything to do with ADHD, right? That may present, that may distract, that may put a wet blanket over their ability to really cognitively engage and pay attention and be present. We've all experienced grief and loss for our lives, for events, for normality, and some of us for the loss of loved ones or relationships. Many families gone through all sorts of stress, upset, disruption, and I'm a parent, Matt's a parent, Shai's a parent. We know the exhaustion that's come with parenting through this, and both the physical and the mental fatigue that this has caused. Disrupted routines. Routines are so important to classrooms and keeping behavior kind of contained and safe, and putting those guardrails up for kids. They know how to predict things. And I can speak for myself. Our routines at our house went out the window during COVID, and frankly, we're still struggling to get back into them. So, we need those routines, and kids need those routines. And we really, got thrown for a loop there. And I'm curious to hear about how that's playing out in the classroom. We know that routines were hard, my area, like going to school, Tuesdays and Thursdays were the blue crew, and then, Mondays and Wednesdays, the red crew. That's not a routine that the kids need. They were instantly isolated, lack of that social interaction, no opportunity for that testing and learning of kind of social norms, bounds, peer-to-peer interactions. And what I'm seeing in the kids that I do therapy with, in college kids, is that they're now unfamiliar, they're uncomfortable, they don't know how to navigate like the stuff that used to be come naturally to them, like going out for dinner, going out to see friends. They lack confidence and they lack interest. We all know what's similar to routine: a lack of structure, accountability, responsibility. Can really not do, we don't do well with that. The screen time for all of us increased, and that's not a judgment at all. People were just trying to survive, and people are learning and working on the screens. But days blended, time blended. It was just a complete lack of structure. And lots of people, kids and adults, wound up feeling just distracted, unfocused, preoccupied, foggy, disinterested, lethargic. And for those that this term got lots of attention, because I think so many of us related to it, is this idea of languishing, where we're just sort of being. And I don't think, from my work, I don't think that both adults, kids, teens, I don't think people are really out of that phase, in my opinion. I think that there's a lot of folks who are still kind of just not firing on all four cylinders, and I wonder how that plays out in your classrooms. And then you're the experts here, but what's the interrupted, unfinished learning gap, whatever term you want to use there? Like, how's that playing out? Is that something that we, as a psychologist, I often think like, okay, we'll figure out the academic stuff. Like, how are we gonna bolster up the resilience? How are we gonna get them engaged? How are we gonna make up for social losses and gaps? That's my priority, and we'll get to the academics, but I know that's not really realistic. And I also don't know what I don't know there. So kids are resilient, but I'm curious to see and hear from you guys maybe how things have how you've seen that gap or that disruption in kind of flow and momentum play out for certain kids, especially those who may struggle already with keeping on task and staying focused. Take a breath there. So, I mean, this is my opinion here, that we're seeing that these impacts on the social, emotional, mental health and wellness of kids and adults are persisting. So that ongoing emotional and behavioral dysregulation, that the less than ideal coping skills, underdeveloped coping skills. We're overstimulated by situations that were once familiar. Now we're unsettled. Things feel unpredictable because the world has felt unpredictable, and I think our kids are feeling that. And it's important to know that things that we often consider kind of quiet, withdrawn, internal mental health struggles like depression and anxiety, often those present as a more kind of internal struggle in adults, but that really can be externalized into disruptive and kind of aggressive or dysregulated behavior when in kids and adolescents. So they are, the behavior you're seeing, it could have nothing to do with attention. It could have nothing to do with that like neurocognitive kind of genesis for these symptoms, and more around the emotional struggles and chronic stress that is felt by them and their families. And forgive me, I realize it's like 2022, but I've been pretty deep into studying this stuff, and find that like even the most even people in the field, even therapists, even folks who are talking about this stuff all day, every day, need to be reminded of what a big deal this was and how pervasive some of the after effects have been for many of us. Not to mention the masks. I feel like I'm missing some masks. I think that's been a fascinating thing to watch. Kids who like the mask, teenagers who like the mask, who find it comforting to have like a little bit of protection there. I don't know if you've seen that, Matt.
Yeah, I think particularly kids who tend toward being more socially anxious have found the mask to be comforting and a bit of a buffer, whereas kids who are more socially outgoing and engaged can't wait to pull them off. And then there was a comment in the chat, I think we can come back to some of these comments soon, about the impacts on social emotional development of masking, particularly for younger children who are still learning to recognize social cues from peers and from adults, and who are struggling with emotional regulation for many reasons probably, but perhaps in part because of some of the developmental effects of masking.
Well, good. We'll come back to that because that's interesting. My kids were in daycare throughout, except for like 6 weeks of COVID. They were masked in daycare. It's amazing to see how kind of resilient they were. And so I'd love to hear how others are seeing it play out. Okay, so the point here is that there's always the behavior, the classroom management, but our opinion is we also have to address the emotional regulation, which is a skill. Some of us are born to have a little bit more strength and kind of intuition in our emotional regulation and our ability to understand and kind of moderate ourselves and our behavior, our thoughts, our feelings. And some of us need to flex that muscle, to be taught these skills, to learn how to kind of better manage those things, these big feelings. So what looks like behavioral problems are often or could be signs that kids are struggling with feelings they don't understand, things they can't identify, they don't have the skills to manage, or that are really consistent with things like depression and anxiety, that when you're looking at a kid kind of with disruptive behavior that's really probably throwing a wrench in your classroom and exhausting you day after day. It's hard to kind of keep that perspective in mind, that like to kind of ground yourself in the potential reasons behind what's going on with this behavior, and then figure out how to manage it or how to best approach it. So, we think about proactively structuring your classrooms, your interactions, to both support students and also to contain or eliminate or reduce on distraction and disruption. So how do you like set yourselves up both, from a routine, a structure, but also a communication style and approach, a way that you are choosing and working to kind of interact with your classrooms and with yourself. So that is going to set you up best to have more success with, better behavior. Kids need school to be a safe place. It needs to be a place of acceptance. It needs to be a place that they feel safe and comfortable, that they can be themselves. And that's more true now. And there's, I feel like I shouldn't be saying this to this group of experts here who are in the weeds doing this, but like at that investment that you can make in connecting personally with students, learning about who they are, fostering that connection, because that was something that was negatively impacted during COVID. And I think we're seeing lots of kids who are struggling to have the confidence and skill to get back out there and navigate this. I also, like, in the back of my head, I didn't write this on this slide, but I also, how do we protect our teachers and our students, or our teachers and our staff? Because how do you do all this? Like, how do you fit all of this in while also maintaining boundaries, taking care of yourself, teaching to the test, teaching all your curriculum, whatever it is that you're already managing, and then thinking about like, okay, now I got to figure out how to develop closer, more independent, like personal, individual relationships with families, and try and foster this connection. And of course, some of this is innate, but I'm just very aware of the pressure and the expectations that you already have on you. And would be curious to hear about whether that's, I'm off on that, or is this something that does resonate of like, oh geez, one more thing we have to do. We talk about what are we trying to reinforce? What are the things that we want to encourage by responding to them versus we want to kind of discourage or fade out by not responding to them. And there's an approach that really is trying to focus on the positive, looking for the good, choosing not to engage in the negative behavior, the problematic behavior, the discouraged behavior, as long as it's not, terribly disruptive, as long as it's not dangerous, to not engage with that, and to instead be looking out for ways that you can compliment, you can praise, you can recognize that positive behavior. And the Child Mind Institute, what they see when they do this very intensive kind of very focused training and skill building in classroom settings for teachers, is that over time, in a couple of months, they will notice that these kids who are used to being redirected, are used to being sort of called out for their behavior being bad, they will start learning that they are capable of getting praised, that they are worthy of that. They want that. They are starting to internalize the good and the confidence instead of failure or reprimand. And that overall the classrooms can really have a feeling of just more joy and warmth and success. For teachers, it could be a big stress reducer, because you're just not having to redirect or correct or kind of say no as much. This is something I can certainly relate to as a parent, that I could see being helpful. Matt, I don't know if you have any chime in. I've been talking a lot.
Well, I think we'll get to I think one of the interesting things about this discussion, when we get to the discussion, is that we've got folks work with young kids and with middle school age kids, and where the rubber hits the road on attending to positive behaviors and ignoring negative in a classroom setting where you've got 15 or 20 or 25 or 30 or 35 kids in your classroom, it can be really tricky. So we can get into some of those details when we get to the discussion.
Yeah. Yeah, and keep in mind, some of this stuff comes from CMI where they are, in an ideal world, you might have a psychologist who's like literally following you around, whispering in your ear, telling you what to do as a teacher, right? And that's not the reality for anyone outside of that type of setting. So I am curious to hear if there's been any sort of shift or more attention paid or value placed on just building a culture and a normality around incorporating social and emotional wellness, awareness, talking about our feelings, our thoughts throughout each and every day. I have observed this in all sorts of other settings, and I think that there's so much opportunity for us to just model a way to name our emotions. Gosh, I am noticing how loud it is in this classroom, and it's making me feel hot in my body. My hands are tensing. My neck is feeling sore. Those are my clues that I'm feeling stressed or maybe getting angry. And I wonder what I could do, because I don't want to feel angry with you guys, or I got frustrated and I didn't, manage that frustration very well. I'm really sorry about that. I wonder what I could have done better in the future. These are things that, for those of you who do it in teaching high school, that wouldn't be the appropriate kind of tone to take. But these are things I think kids can lap up. They soak up. Like they don't inevitably know what their feelings are. And so helping them practice to name it, understand it, let them correct you when they're wrong, give them choices. Maybe you're feeling embarrassed, maybe you're angry. Both of those things would make sense. And it's all about it's okay to have these feelings, and it's our job to learn how to regulate them so that we're safe and contained and able to kind of not disrupt others. So get their buy-in around why it's good to manage your behavior and how it is scary and uncomfortable to feel out of control. Big feelings are always okay, normal. They're always a part of life. And we acknowledge and validate them, that they make sense. They're normal. It's okay. It must suck. It's uncomfortable, and you'll get through it. It won't last forever. And starting to normalize some of the things like the breathing, the taking sort of like a quiet moments, any, physical or mental grounding, thinking about incorporating mindfulness. And I know schools are doing some awesome jobs at these things. And again, I just can't emphasize enough how powerful it is for adults of any kind, including parents, to model vulnerability, self-reflection, the ability to apologize and kind of take ownership of whatever your behavior, your part in a disagreement and an effective situation. It's very, very hard, and it's enormously powerful. So how can we just how do we take every chance we can to live this as we all grow together? It's really good to model the ability to move on, for those who are having behavioral problems, who get stuck, who act out, who are learning these things. How do you give students an opportunity to repair, recover, and move forward? Model forgiveness. Think about these ideas of a fresh start. I love this term, like an off-ramp. So how do you give them a way out? How do you give them a pass to kind of de-escalate a behavior on their own, and really show them that you truly mean it, with like clean slate, fresh start. Go walk it off, get back here. And we'll start from the beginning. This is not going to follow you around forever. And this is especially important with kids with behavioral problems and ADHD, is that if they carry the guilt and shame and that every kind of mistake or outburst or unwanted behavior brings, they'll be crushed. They'll never move forward. So really the ability to let it go, to move forward, fresh start. And then here, these next couple of slides, I don't want to spend too much time on because this is the stuff you guys do, just emphasizing, well, maybe you don't, because like I'm a psychologist and this is what I struggle with at home. So like, maybe you don't do it. I don't know. But, this idea of structure and routines, of really presenting information in numerous ways so that kids have opportunities to absorb it with their own particular strengths and time and areas of skill, whether it's reading orally, repetition. Routines are meant to minimize the disruption to learning process, to provide predictability, safety, be consistent, and some ideas, and I'm sure you guys have many, like how do you stand at the door and greet them every day? How do you kick off the school day, the same way every day? That really just signals to them it's time to sort of transitional learning. What are the tasks around that are going to be least disruptive for the kids and for the class, around going to the bathroom, about needing to, stand up and get your wiggles out. And then how do you close the day? I'm the queen of, a stream of consciousness of instructions toward my own kids. So how do you not do that? How do you not sort of remind them things on the way out the door? Thinking about how kids with ADHD and then all sorts of, kids with all sorts of struggles have particular difficulty with transitions and any sort of unexpected changes or disruption to their normal routine. So how do you forecast? How do you provide updates? Give them a countdown, a warning, like whatever it is to like give them a heads up that something's coming and leading up to that transition, and play around with this. Like what some kids don't need this. And so what does your classroom need? What is working well for them? What is not? Don't ever kind of, sacrifice the physical activity or exercise, because that is such an important this is such an important activity and skill to help kids, focus and regulate their behaviors, their emotions. And then breaks, how you not only build in breaks literally to within the day, that especially during high cognitive demand tasks and activities, let them move, but then also breaking down tasks and schoolwork and assignments into clear, manageable steps and chunks. And let's see, I'm not going to read off these, but good reminders around just looking for behaviors, making things clear. A lot of times we think that we have made ourselves clear and our expectations clear, and we really haven't. We haven't checked that. How do you minimize distractions? How can you, how do you observe your classroom and the individual personalities that make it up for potential to support one another without placing, burden on certain kids? And how do you work with parents, again, without it taking over your evenings and your weekends? How do you work with parents to understand what's going on at home, what's working, and also let me tell you what's working here, what's not working. So I'm going to pause there because that's really the bulk, and I want to get to this discussion, Matt.
Yeah, I think that's a great idea, and I think I know we had planned to talk about some specific strategies in the classroom about behavioral management, particularly for kids with ADHD and executive functioning deficits. We can do that if folks are interested. We can also speak to some of the really interesting stuff that's come up in the chat around some other classroom strategies, including social emotional programming and journaling. So I wonder whether is it an option, Lindsay and Shai, to drop the slides and to go see faces?
Let's do it. I'll work on that now. I don't know if we can get videos, but at the very least, I think everyone is able to talk, and you are all muted on your own.
Okay, super. If folks are comfortable, I'd love to pick up on some of the themes that came up in the chat. Cheryl Fritsch talked about working with younger kids. I'm not with 3 to 6 year olds. I'm not sure if there are other folks on the call that also work with preschool, pre-K, early elementary school age kids. But would love to pick up on Cheryl's comment about some social emotional delays that they're seeing and the use of some social emotional strategies to address those delays. Cheryl, I'm not sure if are you able to share more about what you're seeing and what you all are doing at your school?
Hi, can you hear me?
Yep.
Hi. No, we actually have just, we went back very early, back from the pandemic. And so the children at that young age, they're not able, to see and to, and to kind of see what their friends are doing. So we've used an awful lot of, social intervention, feelings and different things like that. But I wasn't sure if there was anything else that we could possibly also do.
Sure. Are you all using sort of a formal social emotional learning curriculum, or
It's called PATHS.
Yeah. Uh-huh.
So I don't know if there was another one that you would recommend that we could possibly do, but that's the one that we have now, where there's a helper friend. They're all working, on compliments, on different things like that, and it seems to be working. But we still have a lot of children, that maybe need more. Wasn't sure if you had another recommendation on a different program.
Yeah, I think passive is a terrific one. I think there are a lot of good ones in that age group. I've worked a lot with Second Step as another curriculum that's used in that age group that I think is terrific. And if folks, and those of you that are involved in making programming choices for your schools, for kids of any age, from preschool through high school, there's a terrific resource that's called CASEL. It's the Center for Applied Social Emotional Learning, CASEL.org. That reviews all of the programming and curricula that have been created and describes what's the evidence for how well they work and how much they cost and how easy they are to apply and how long the training takes and all that kind of useful information that you need to make a selection that's right for your school. So that's a resource that schools that we work with use quite often to make those kind of choices. I think irrespective of any individual program, I think thinking about how you integrate it into your school day is a big challenge and opportunity. I think what some schools tend to do around SEL learning is spend a week or 2 weeks on an SEL block of learning. Maybe it's the beginning of the year, maybe it's the middle of the year, and then go back to kind of regular programming. And I think what most of the evidence shows is that's better than doing nothing, but it's actually much better to use a little bit of classroom time every day or every week, reinforcing social emotional skills and have that extend throughout the school year, rather than do it just in one intense block of time and then sort of move past it. Because kids need repetition, and they really, really benefit from you using the same language to describe what you're hoping to see from them again and again and again, day after day, week after week throughout the year. So, for younger kids, oftentimes the best way to start is with what Lindsay was talking about around identifying the bodily feelings that go along with emotions. And so asking kids to do check-ins with their bodies. I think with really young kids, I think some of the Sesame Street materials that are available on YouTube that use sort of body scans and basic mindfulness practices for young kids is a really, really good thing to introduce and then to use again and again and again throughout the school year. Kids will then start to use those skills as well on their own, and they really respond to them being reinforced. And then, of course, you can share with parents what you're showing kids, and parents can use some of the same language and the same suggestions at home. So those are some of the things that come to mind for me. I think what you were alluding to seems really right to me, that kids, the combination of masking and also being out of school, even for a few months, if not longer, really has been disruptive for kids. And at the same time, kids can make up ground quickly. So I think that really emphasizing social skills, emotional skills, and the capacity to sort of to build up their endurance for attending in the classroom is something to really focus on with the younger kids. I'm wondering if those of you that work with older kids, with elementary, middle school, even high school age kids, have also seen some social effects from kids sort of coming back from. I mean, we're talking about the pandemic as though it's over. It's not over. It just obviously has changed quite a bit and is much less of a daily factor for many of our schools' lives. But what do you see in elementary, middle school, high school age students with regard to social challenges? I know it can be tricky to speak up in a group that's not acquainted. So would welcome anything that folks are seeing, observing, wondering about, struggling with. I wonder, Kay Hedglin, I don't know your first name, but you mentioned you got your hand up. Thanks. Please go ahead.
Oh, is it me?
I see Karen. Yeah, Karen, please go ahead.
I teach with a mixed age group in a Montessori classroom. We have 3, 4, 5, and 6-year-olds, and we noticed with the children that we've had for 2 years that are on the other side of the COVID and the lockdown and everything, that they find it very hard to engage each other. They don't know if they want to get into a game or they want to work with somebody or play with somebody. They really seem like stumped. Like, we're finding that we're giving them the language, but setting it up so that they can get into the game. We established a rule: you can't say, you can't play, but it means that the person that's coming into the game has to initiate asking. And we find that has worked, but also appropriate engaging, like not just going up and body slamming somebody, but saying, oh, can I play with you? You know, that's what we're seeing a lot of the time. The children aren't really sure. They'll, kind of parallel play, but they're kind of past that age of parallel play, but they're not really sure how to engage each other.
Right.
Do you follow me?
Follow 100%. I think that's something that we've seen a lot as well. And it really just comes from practice and exposure, right? Of course, there are, we see kids, for example, who are on the autism spectrum, or kids who may have significant anxiety symptoms, for whom initiating verbally may be really challenging, may be particularly challenging. But for those kids, even nonverbal initiation can be a really useful thing to look for and to reinforce. So kids who may really struggle to initiate verbally, but can initiate play with eye contact or with a gesture or with an invitation that's nonverbal, those are all things that are stepping in the right direction, even for kids who may have some developmental differences. I think for kids who don't have developmental differences and they're just struggling with social skills, I think what you're describing is a really great opportunity to jump in with reinforcement. So as you're monitoring a class, or during playtime or unstructured activities, which I know there's a lot of at Montessori, and you observe an interaction that's in the direction of what you hope to see, that you not miss the opportunity to reinforce that and to notice out loud with praise and attention to an interaction that was positive and pro-social, a child who invited another child to play, or who was really sort of gentle and inviting, or who two kids playing who then include a third kid who wants to join. They pick up on that social cue that there's a third kid who wants to play with them, and they invite that kid in, making sure that those don't go uncommented upon, but that we jump in as the adults in their midst and say, hey, what a terrific job you did, inviting Danny to play with you. And I noticed that Melissa was trying to join you guys, and you didn't notice for a while, but then you noticed and you asked her to join you, and it made her so happy. So making those comments that reinforce the positive behaviors, and then when there are behaviors that are happening that are less positive, that may be a little more less pro-social, more disruptive, a little bit too rough, as long as kids aren't being unsafe, doing our best to really just sort of ignore those behaviors, because by calling attention to them, we might unintentionally reinforce them. So rather than make a big deal out of a kid who's a bit too rough, or who doesn't make great eye contact, or who isn't as inviting as we hope, just sort of let that pass by and look for indications of the behavior that we want to see and really make a big deal out of that.
Just chime in quickly that what you started with, that phenomenon of like this, they've lost kind of that practice of navigating social skills. I do a lot of therapy with college age kids, and I've seen exactly that at their age and their social kind of their normal social activities and challenges and tasks. So they're self-conscious, they don't know what to do, they're uncomfortable. So it's interesting to see it persist over, multiple ages.
Hi, yes, this is Kira. And it's funny because Karen was saying we're seeing, like you guys are saying too, that we're seeing the same thing with the older kids. It's just at a different scope. It's the way that they are so lax, and it's disrespectful to us, but that's just because maybe they've been socially just kind of not structured at home, doing kind of what they feel like, even with the pandemic, not having the same kind of structure. And so then when they come in, it's not that they want to be that way, but they are kind of, hey, you guys are our teachers, but you're also our friends, and we're just going to kind of pal around and do, and it becomes, yes, like, how do we address that? Like, we don't always do it well. And like Matt was saying, like, you want to do it in a positive way and identifying the positive things they do. But there's those moments when you got to call out hey, you gotta, you can't address us this way, or, so yeah, it's interesting. It's just on a different level.
Yeah, I think those are terrific reflections and good example of how we have to sort of adjust expectations developmentally. And of course, young 4, 5, 6-year-old kids are exquisitely attuned to pleasing the adults around them. They don't always succeed at it, but they're attuned to it and they're motivated by it. And middle school kids less so. They're much more motivated by pleasing their peers. That's sort of the first and most powerful social input that they're looking for. And so noticing with kids, not in public because it would be shaming, but in one-on-one conversations about what you're noticing about how other kids respond to them, I think can be very powerful. I noticed when you did this thing in class, when you made this comment that it really caught the eye of a few other kids in the class. They were really interested in what you had to say. They stopped what they were doing. They were really hanging on your every word. They really want to hear what you have to say. Like, that's very powerful feedback for a middle schooler. And by the same token, if you've got the kind of relationship with a child where you can give them more constructive criticism, say, I noticed when you were being silly again in class, it wasn't just sort of bothering me. I noticed that some of the other kids in class were kind of getting annoyed too. Like, they were kind of trying to keep up with the lesson. And when you kept making those silly comments that were kind of distracting, I think it's actually kind of bugging some of your classmates. Maybe you ought to pay attention to that. And that feedback about the social cachet of their behavior, I think is very powerful for middle school students.
Thank you.
Yeah, of course. I wanted to ask as well. We've got about 10 minutes left, and I appreciate all of the interactions. I want to ask what works for you all well, and what works less well when you're trying to collaborate with clinicians outside of your school. So if there's a child that you're concerned about that you think needs clinical attention more than might be available at school, what are examples you've had of working with a clinician who really is helpful to the family and also to you and your school, as opposed to what's less helpful? What's the kind of relationship that really works when there's a child who might be concerned, has ADHD, or maybe depressed, or is experiencing trauma, or something else is going on that really worries you? I think Karen's got a hand up.
I have been in teaching preschool and kindergarten for over 30 years. And I think sometimes when dealing with clinicians, they don't realize that behind us comes experience. And we would not be recommending a family lightly. Like, we've probably had 3 to 5 conversations with that family, preparing them to make the next step. And that clinicians sometimes don't take into account that we come with experience too, and that we would not be pushing a family to seek professional help if they didn't need it. And sometimes I feel that our experience, like we're not doing it just for fun, that we're seeing something and we're seeing them in a group of their peers, how they're functioning in a group or how they're not functioning in the group. And sometimes I feel that the doctor, the clinician, sometimes makes light of the opinions we put forward. What's your opinion on that?
I think that is like spot on and razor sharp. I think the reality is I've been doing clinical care almost as long as you've been teaching, Karen. You've seen more children than I have. You've got more context than I do because you're taking care. You're in the company of dozens of children every day, and so when something seems developmentally awry to you, that's really, really vital for us to pay attention to, because you've got this great context of seeing 15 or 20 or 25 kids in your classroom, and this child is concerning to you because it's really standing out, this behavior. Now, we may have some dialogue to do about what's the meaning of the behavior, what's causing it, what's the next step to do that might be most helpful, but taking it absolutely seriously that you think this is worthy of clinical attention. I mean, I think that's a prerequisite of anybody who's going to work with schools as a clinician.
Thank you.
Yeah, thank you. I think it's a great point and a good reminder of the humility we need to have on the clinical side.
Yeah. Yeah.
Are there experiences that you all had that have been particularly positive with clinicians?
We've got a comment here, the clinician coming in to observe the child.
Uh-huh.
I wonder how.
That was from Maria. Maria, would you like to join in audibly as well?
Sure. I think there's times I work with Karen in that type of school setting, so it's the young children again. But I often find the clinicians, we have more experience because we're with them every single day. And often the clinicians just wish to work with the parents and not work don't wish to work one-on-one with the child. But there's times the parent they're part of the environment. So sometimes they're part of the problem. So I think working with the ability to work with both is so important. Do you guess what I'm saying? So coming in to observe the child within his peers and hearing from us and what our observations and everything are.
I think that's really, really valuable, and particularly as you can imagine, as clinicians, we might see a child in our office, and in the the novelty of an office setting with an unfamiliar adult, oftentimes we won't see the behavior or the emotions that are happening in the child's everyday life that are of concern.
Exactly.
It's important that we not write them off, but sort of say, well, there's something happening in this child's everyday life that I'm not seeing, and so collaborating with teachers, collaborating with parents, and also just the value of a little bit more time with kids, things tend to show themselves.
Yes. But and having said that, we have often worked with clinicians, and I find when we do work as a team and they do come in and observe, and we all work together, if they tell us what they're working on within their office, so then that we can apply it in the classroom and use the same language. Or we've often done Zooms. I've done a Zoom with a clinician and a parent. And so we talk, just the part of the mom's session with the therapist or whatever. And that's not for every session, but like once every few months or something. And they give me tools what they're working on, and we use the same language and work on in school. And that works very well.
Yeah, I think it's one of the great benefits of all of our increasing comfort level with virtual technology is that it makes the potential to collaborate, clinician to parent, clinician to teacher to parent, so much easier than it used to be.
Yeah.
I think even just hopping on Zoom for 10 minutes in between classes or in between patients is a really good way for folks in your boat and folks in ours to put our heads together and to collaborate.
Absolutely.
Karen, I see your hand raised. I'm not sure if that's from before, if you've got another point or question. It was
Sorry, technology is
No
beating
worries.
me today.
no worries. It was a stray hand.
Oh.
So, Lindsay, ought we to close the hour by sharing a bit about how we might collaborate with folks on this line and folks in their network in the future?
Yes, that sounds great.
So, as Lindsay and I said at the outset, our team, our practice at Fort Health is new to New Jersey, and the primary way that we're hoping to serve children and families in your state is through working with their pediatricians. So we're doing quite a bit of outreach to pediatric practices throughout the state. As you all know, the frequency of mental health concerns in kids has gone through the roof in the last several years. And so many families are going to their pediatricians asking for advice or for help with children struggling with sleep or with disruptive behavior or with sadness or loneliness or anxiety. And pediatricians are oftentimes at a loss for how to help or what to do because the resources are so limited. And so what we're trying to do is be available to pediatricians as a resource to work with them, to provide direct advice and coaching to pediatricians, as well as to be available to see children for evaluations, for therapy, for coaching for parents, for psychiatric consultation. And so if there are families that you're working with through your schools that you feel as though are struggling to access good care, good clinical consultation, good resources, please encourage them to talk to their pediatricians about Fort Health. I think that we've got a terrific clinical team. We feel really excited about collaborating with pediatricians and about collaborating with schools and educators as well. Every treatment plan that we create for families involves a strategy for collaborating with school to make sure that the work that we're doing with kids and their parents is going to be beneficial to kids' lives at school as well. So we hope to have the opportunity to collaborate with you and your colleagues at your schools in caring for kids going forward. Lindsay, anything that you'd add?
It just, our model is the therapy should not be forever, right? That this is a time-based intervention that kids can come in and benefit, take great benefit from even a handful of sessions. And, the hope is that as we all grow more comfortable with just, I hope, and I think that we're making progress, is just growing more comfortable with talking about the realities of our emotions and being accepting of struggles in this way, that we can start helping kids out much sooner, much earlier, before things they don't have to get bad, right? They don't have to get to a point of crisis or emergency or dysfunction. So it's really Fort Health is here to give parents, families, pediatricians like very actionable and results driven interventions. And really appreciate you guys taking some time to come have this discussion with us, because our goal is to learn from all of the experts in children's lives, and the schools, and your interest and dedication to their emotional health and their overall well-being is much appreciated, and we have a lot to learn from you.
Thanks so much. Glad to be with you all. Stay in touch and best of luck.
Thank
Thank
you.
you guys. Thank you.
Thank you
Thanks,
very
everyone.
much. Have a great
Thank you
evening.
very much.
Thank
Bye-bye.
you.
Thank you.